mynews.studio.
On a hot August morning, a $2.5 billion pledge is set to reshape women's health. Why is this happening now? And could it really make a difference?
Today's date is August 9th, 2025. The Gates Foundation just made its largest ever investment, $2.5 billion aimed at transforming women's health worldwide. This isn't just a headline. Why is this shift happening at this moment?
Timing is a big factor. Public funding for women's health research has actually been going down, especially in the U.S. Right now, only about 1% of global health research and development funding is focused on women's issues outside of cancer. The Gates Foundation is stepping in and targeting 5 areas that don't get enough attention: menstrual and gynecological health, contraceptive innovation, sexually transmitted infections, maternal health and nutrition, and pregnancy safety. These gaps have been around for decades. And pregnancy safety. These gaps have been around for decades.
That's a pretty wide range. But why have these areas stayed on the sidelines for so long? Isn't women's health supposed to be a basic part of healthcare?
You'd expect that, yes. But historically, medical research has mostly focused on men as the standard. Bill Gates himself brought this up during the announcement. The effect is that women's health issues are often misunderstood, misdiagnosed, or even overlooked, especially in lower-income countries, where risks from pregnancy and childbirth remain high. Conditions like preeclampsia are still poorly understood.
So when we talk about this investment, what does it actually fund? Are we seeing more research papers, or are there real solutions on the way?
It's both, actually. The money will go toward developing new medicines, vaccines, diagnostic tools, and reproductive health solutions, things specifically designed for women and girls in places where resources are limited. For example, there's ongoing work on maternal vaccines to protect newborns, protocols like Kenya's E-Motive to cut down postpartum hemorrhage, and research into the vaginal microbiome and non-hormonal contraception.
But how do they make sure these new tools actually reach women who need them, especially in countries where the health system is stretched thin?
The plan is to work directly with women in low and middle-income countries to figure out what's most urgent. They're designing with under-resourced health systems in mind. Plus, they want to involve governments, NGOs, and private companies to co-invest. The goal is to break through not just medical barriers, but also the bigger systemic ones.
That's a big undertaking. What kinds of breakthroughs are they actually hoping to see?
They're aiming for more than 40 innovations. Some examples include first-of-their-kind treatments for preeclampsia, new non-hormonal contraceptives, and better diagnostics for gynecological conditions. The idea is to deliver advanced, appropriate care to millions who don't have access today.
And how do they know if it's actually working? I mean, it's one thing to spend money, but how do they track real impact?
They'll be collecting data and measuring impact, tracking how many new products are developed, how widely they're adopted, and whether health outcomes improve. They're also looking at economic effects, since every dollar spent on women's health can generate $3 in economic growth. Plus, they've promised to share regular, transparent updates.
Given that only 8.8% of NIH-funded research has focused exclusively on women in the last decade, could this be a turning point?
It's possible. A lot of experts see this as a major new source of funding, especially as other sources are getting smaller. If it succeeds, it could encourage governments and other funders to rethink what gets prioritized. The bigger test is whether this sparks a broader shift, putting women's health firmly at the center.
So we're talking about more than just new treatments. This is about changing how the world values women's health, both medically and economically.
That's right. If both the medical and systemic obstacles are addressed, it could impact health outcomes and even shape economic and social futures for women everywhere.
Which brings us back to where we started. A $2.5 billion pledge is significant, but will it lead to lasting change? Or is this just the start of a longer journey?
That's the central question. If this leads to more investment and innovation, it could be a real turning point. If not, there's a risk the cycle of neglect could continue. But right now, women's health is in the spotlight, and that's the first step toward change.
Thanks for joining us as we explored what could be a pivotal moment for global health and for half the world's population.
We covered the Gates Foundation's $2.5 billion pledge, the 5 focus areas, the planned innovations, and the call for a new approach to women's health.
Thank you for listening. This episode was brought to you by mynews.studio. Try it now for free.